Hi everyone, my name is Saul Gonzalez. I am the Public Health Preparedness Trainer and I'm going to be presenting on Middle East Respiratory Syndrome, also known as MERS-CoV. MERS is actually a viral respiratory disease, more specifically a coronavirus, which was first identified in Saudi Arabia in 2012. It is a zoonotic disease, meaning that it was first identified or it originated in animals and was then transmitted to people. Here in the United States, it poses a very low risk to the general public. There have only been 2 cases confirmed here back in May of 2014, and both cases were able to fully recover. So, how is MERS transmitted? MERS is transmitted by water droplets expelled from our bodies when somebody coughs, sneezes, or breathes. And it is usually transmitted to close contacts of an ill patient. So this could be a family member living with an ill patient. It could be anyone who traveled with the ill patient, or even anyone providing care to an ill patient. So here we have a chart to describe the susceptibility of different people who more at risk of getting MERS. This chart is from the CDC, so you can go ahead and take a look at that. But essentially, the main risk factors are anyone who is over the age of 65 and under the age of 12, anyone who has a chronic health condition, an immune deficiency disorder, anyone who has cancer or any terminal illness is more at risk of getting MERS. So, what are the signs and symptoms of MERS? So, these signs and symptoms for this disease are actually quite similar to those of the common cold. They include fever, cough, runny nose, and shortness of breath, which are the 3 most common symptoms of a person infected with MERS. And then they could eventually progress to pneumonia, chills, body aches, sore throat, headache, nausea, vomiting, and diarrhea. And the incubation period for this disease is 2 to 14 days, so you could start showing symptoms between this time frame. So testing and diagnosis, the way that tests are done to diagnose MERS are molecular tests and serology tests, but for our health department purposes, we use the molecular tests, which include the PCR test, and those are able to detect active infection. So for treatment, there's actually no specific antiviral treatment recommended for MERS infection. Um, Individuals with MERS are often prescribed medical care and other pharmaceuticals to alleviate symptoms and also to include vital organ function. So, how can we prevent getting MERS and spreading it to other people? Um, it's as easy as washing your hands for at least 20 minutes or 20 seconds, I'm sorry, with soap and water. And if that's not available, using hand sanitizer, covering your nose and mouth when sneezing or coughing, avoiding touching your eyes, mouth, and hands, personal contact, so social distancing, especially when somebody is ill, and wearing your personal protective equipment when dealing with a patient with the infection. So why is this important? So it is important to us to know this information because we want to be prepared for an outbreak of MERS, but in general, any kind of infectious disease outbreak, and most importantly, to prevent the spread of MERS and to minimize the impact on patients, on our facility, and on our staff in order to keep providing our services to the community. Here are the references if you would like more information. And again, thank you all so much for your time, and please don't hesitate to contact me with any questions you may have. Thank you.